Good morning.
Malo Leslie Fuaman, thank you for having me this morning. It's very cold here in Wellington. How's it up there in Auckland?
Not too bad.
It's hot with your blues top, eh? That's why, eh?
Yeah, well, I always wear a uniform for the winning team, so
Yeah, sorry, no Hurricanes flag today,
I
but that's
know.
okay.
Unlucky. Yeah, very
Yeah,
unlucky last week, but I know you are a Blue supporter, so thank you for that, Minister.
yeah. Four of my kamaiki were born in Middlemore Hospital, so
Yeah.
I'm going to take that half of my family and wear my blues pride this weekend.
Excellent. Okay, Minister, ole facility more than 8 out. Next month, ole FIFA World Cup, ole host Australia and New Zealand. Ole ase vaeng of so tele malo for lele in if so swani mol vaeng to my tai. In a fa o pela to FIFA minute along, especially soccer plays, Minister.
Yeah, so football is the largest playing sport in the world, and the FIFA Women's World Cup kicks off here in New Zealand and Australia in about 37 days.
Yeah, yeah.
So over 1 billion people watch this World Cup across the world. That's how big it is, and we're expecting over 30,000 people to come to New Zealand in July just to watch the games. So what the government has done is a number of things. One, we've supported a number of our local clubs to upgrade their facilities. So in Mangele, the local football club there, which is going to be hosting one of the teams, they've had some upgrades done to their bathrooms and changing rooms. We've seen that right across the country because a lot of the host cities, which is Auckland, Wellington, Hamilton, Christchurch, they needed to upgrade their facilities. The next bit that I've just recently announced as part of my capacity as the chair of the Lottery Grants Board. So every time New Zealanders buy a lotto, parts of the money go back to the community. So I'm the chair of that board that distributes that money. So the Lottery Grants Board has allocated money again throughout the country to help now programs to increase women participation in sport, women leadership programs. For Wellington, they're doing a Matariki festival. So there's around 5.3 million that I've approved to be distributed throughout the country for that. So it's a very big deal. I think New Zealand will understand how big a deal it is in the coming weeks when we have over 30,000 people come to watch these games.
Excellent. Thank you, Minister. Let's talk about the government's new roadmap to tackle rheumatic fever, please, Minister.
Yeah, so as many of our families know, especially in South Auckland and again in Porirua as well, where it's prevalent, rheumatic fever is a huge issue for our children. So what happens is the Gamaiki will get a sore throat, and then if it's not attended to, it can lead to rheumatic heart disease. And it can cause, debilitating heart diseases. I remember one of my cousins had rheumatic fever as a child, and he had to have heart surgery for it. So our Pacific people make up 60% of the overall rheumatic fever cases, with Māori following at 37%. So effectively, it is really a disease that affects those of low income, in particular our Māori and Pacific. So over the last 10 years, throughout different parts of the country, there has been different programs that have helped to prevent it or identify and then sometimes manage the fever across the country. We've seen a drop in rheumatic fever cases because of COVID, but what's starting to happen is it's slowly starting to climb back up. So what we announced earlier this week, and Anai, Dr. Neru Levasa, did it for me in Otara, is basically a plan as to how we're going to work within the health system to tackle rheumatic fever. So what that plan shows is improved access and coordination of care, and that includes the transitions between, sometimes they're older kids that get it, so teenagers. So when they transition to adult services to try and help them and their families. We also want to reduce the barriers for patients to try and get like a throat swab. So there's a number of different measures which have worked over the 10 years, but we're pulling it together and being much more strategic about it.
Excellent. Minister, let me ask you, please, Oani Sosanil Malo, because another thing you're letting out for Tatu Tangata for Samoa Pacifica gambling, fanging of pokie machines. Ini swinga mandi fufuanga malo in if Sosani more Tatu Tangata left after family money.
Yeah, so it's been a busy week for me. This has been another one of the announcements that I've made in the last week is around some of the changes that we're making to regulate the pokies. Yeah, we know it's a massive problem within our Pacific communities, but also we know that a number of the accessibility to pokie machines is obviously very big in some of our areas. So what we've done is last year we consulted on some changes, and then this year we're going to make them happen. So from the 15th of June, there's going to be 3 new penalties that will come into force around basically what the existing harm minimisation rules are. So, to reduce the gambling harm, including on the branding and advertising requirements. So there's 3 new penalties for that. From September, we're going to have new requirements about what gambling awareness training must cover. So for those people that are in pubs, clubs or TABs that have the pokie machines, the people who have to deal with the sort of gamblers in that place will now need to have new training so they can identify what some of the problem gambling symptoms are. And then from the 1 December, there's going to be a requirement for the pubs, clubs and TABs to have a new venue layout. So that's where staff can easily monitor any ATMs from the main bar, because currently there's no rules around where staff need to be to see the ATM, because some clubs have the ATMs within the clubs, and the pokie machines, they must not be allowed to be seen from outside the place. We also, one of the things that is going to happen is that there needs to be what they call a regular sweep. So the person who's responsible for the gambling minimisation, they need to do a sweep, and some of their staff need to do a sweep through the venue at least 3 times an hour. And the reason why we've gone to that is because then they can pick up someone that after doing a number of these sweeps, if the person is still there, it means that they've been there for a long time, not just an hour. They might have been there for a number of hours. So we've put in some regulations coming in from 1 December. So, each year pokies are the biggest driver of people seeking gambling-related help in Aotearoa. Fortunately, Pacific people, Māori people are one of the biggest uptake of seeking gambling harm help, but we want to make sure that we tighten it on the other side as well to help minimise the harm from gambling.
Thank you, Honourable Minister. It was nice talking to Dr. Anai Neru Lamsa last week, MP for Takanini. And the announcement from the government, Nisho Tula Fono, Pupuia, Naifanau, vaping. Unfortunately, Honourable Minister, some parents are saying the governments are not doing enough. Like at the town of Asala, Lato for Ilele, all of Atawinatu, vaping. 10,000 in a year, lava pupuya naifanau. What can you say about this, please, Minister?
Yeah, so definitely acknowledge the concerns of parents for their children who may be attracted to vaping or are vaping. As a mum, I have exactly the same concerns. The difficulty with the changes that we've made is that since vaping has come on board, is we have seen a significant drop in cigarette smoking. So it is a very effective cessational tool for those who want to give up smoking. So we've had to make that difficult balance between making sure it's still accessible for those that smoke cigarettes to transition, but at the same time, as parents have rightly pointed out, we want to prevent our kids from getting this. So that's why the restrictions on product flavours. There were products that are being sold currently that attract young kids, like gummy bear, bubble gum. We're now restricting those descriptions for the flavours. You can't have the new vape shops near schools or marae within 300 metres. And then disposable vape. So this is probably the one of the most effective ones, is that the reason why young people can access vaping easily is because you can just have a disposable vape that you can then chuck away. It makes it very easy for them to access it. So we're now saying you're not allowed to sell those disposable vapes. So obviously with any sort of rule changes, we do watch what the changes are, behavioural changes are, and we review them. So for example, if we can see that these changes don't go far enough once they're in, because they're not in at the moment, they're coming through. But once they come through, then if we need to change it, we will do so in the future. But at the moment, this is the balance that we're trying to strike, so that we can have people that smoke sikalekis can get off the sikalekis and then move into the vaping, because it's less harmful. But again, I really acknowledge what our parents are saying, but at the moment, we're trying to strike that balance.
Yeah. Honourable Minister Barbara Edmonds, thank you so much for your time this morning. Yeah, and go the Blues.
Yeah, go the Blues. What do you think? What do you think the score's going to be?
Well, I did say to Janine this morning, Blues 24, Crusaders 19. So it's going to be a close game, but Blues will take it.
Well, see, Hurricanes did beat the Crusaders, so they can totally do it. You know?
Exactly. Thank you, Honourable Minister.
Yeah, Manuela Tayao.
Thank you. For Honourable Minister Barbara Edmonds,